Hello and welcome to the Ground and Grow podcast. I am your host, Kayla Williams. Today I am going to do just a topic-based episode, so back to kind of what I would do almost for all my episodes before, so just delving into a topic. And this is one of my specialties, so postpartum mental health, postpartum anxiety, which is what I deal with most often with my clients, more like kind of my niche area in the postpartum mental health area. And in this episode, I'm going to be talking about, is this just kind of the regular like newborn worries, adjusting to that transition, or is it postpartum anxiety? So, this I think is something that like people kind of struggle with, right? Like, oh, hey, am I actually feeling anxious, or is this just like a new transition and the change in my hormones and it's like not going to be a big deal? I don't really need help with it. I want to name first and foremost that even if you don't meet this criteria for postpartum anxiety, you still deserve support. You can still go to therapy. I, as a therapist who specializes in perinatal mental health, would not bat an eye at a client coming in who's like, yeah, I don't actually have a ton of anxiety or depression or any of these like big symptoms, but I just want to like hold space for myself during this transition, right? I'd be like, yay, this is great. And in fact, I think is so lovely, right? Myself, I knew I was going to struggle with anxiety right off the bat, and I certainly did. Like the moment I got pregnant, that anxiety boosted up a bit for me. So that was no surprise for me. But even if that wasn't the case, I would have booked some additional sessions with my therapist, who I kind of see on and off during life transitions. So I was meeting with my therapist a bit more during those transitions in my life, just because I knew I was going through changes and maybe needing a little more space to just process what was going on, connect to the intentions that I needed, get some good self-care routines in place. So even if you don't feel like, oh, I'm really struggling with this, if you think you could use support, get support. So I'm not saying this is the criteria for which you deserve mental health support. You deserve to go to therapy. You deserve to go to therapy if you want to, right? Regardless of the other stuff. But if you're going through this and you're like, ooh, like I'm at the threshold where I really like might need more support, this topic might feel helpful for you to process that. So first and foremost, right, like of course we're going to feel a little bit more worried, maybe feel a little bit of anxiety during these transitions, whether it's the moment you got pregnant or the moment you're bringing new baby home. You're going to feel some more worries. You're maybe going to feel a little bit more cautious. And that's a good thing, right? Because there's like so many new things that you're navigating, right? In pregnancy, you're figuring out, okay, like what are activities that I need to shift or do, or how am I making sure I'm getting to all my appointments and taking the right vitamins and, preparing for bringing baby home, preparing for childbirth, all of those things, right? Like we're going to feel a little bit more worried, a little bit more cautious. We're going to have more on our mind because there's that new transition. And then after baby's born and you're bringing them home, you're of course going to feel a little more cautious, right? You've got this like tiny little delicate, fragile human being who needs you for everything, right? They cannot meet any of their needs on their own. They need you for everything. You're going to feel a little bit more on edge of like, okay, like I got to make sure I'm taking care of them in a good way and meeting their needs and paying attention to all the things I need to pay attention to. So it is healthy and normal for us to feel a little more cautious, maybe a little bit worried. So there's like definitely a normal range for what those worries can look like. So I'll just kind of talk about what are some common things that people might have these extra worry thoughts about, what that can look like. I'm not saying that this is like across the board exactly what it looks like for everybody, but just some common ones that I see in my practice or with folks I know who feel a little bit more worried, but it's not necessarily full on postpartum anxiety. So one might just be like feeling a little bit overwhelmed with all of the new tasks, right? Both in pregnancy, and I'm talking about pregnancy too, because while I know I'm kind of referring to it as postpartum anxiety, but really it's perinatal anxiety, right? So it can be pregnancy, postpartum. It can also be as you're preparing to try to get pregnant or if you're going through infertility stuff. So even if you don't have that baby yet, like you can feel these different things and experiences. Um, but right, like the moment you're pregnant, you might be feeling a little overwhelmed with like, what are all the things that I need to do and the appointments that I need to schedule and things that I need to buy and have in my home, right? Feeling a little bit worried, maybe not to the point of like full on rumination or like feeling like, oh gosh, like I'm so jittery, I can't think of anything else because I'm so worried about it, but being like, ooh, I'm a little overwhelmed. There's a lot of things to figure out. Or after baby is born, feeling like, okay, now I need to keep track of how many diapers they're having a day and how many ounces of milk they're drinking or how many times they're feeding throughout the day, what their sleep routines are like, making sure all these things are in place. Like you're getting used to a whole new role, taking care of a new human being. And while a lot of it is like very intuitive and we can know what to do, um, there's also new things that we're kind of making sure that we're doing and checking on the things that we're not thinking about. And I know certainly from my experience, like in the hospital, it was like, okay, track every feeding and track every diaper and all of these things. And I know they do that because they want to make sure nothing else is wrong. And for me, like my kiddo was born a bit more jaundiced. And so like we were really keeping an eye on all of those things to make sure she was okay, or if we needed to do the light therapy, which we had to do, it's a side tangent. But anyways, you're kind of depending on the setting that you had your baby in, you're probably getting fed some information about like, here are all the things that you need to keep track of. And I'm not saying it's bad to keep track of that, but I think it can be overwhelming, right? And I'll talk about like if you are going through postpartum anxiety, that's going to be even more elevated, which I'll talk about later. But it makes sense to feel overwhelmed with that, right? It makes sense to feel like, oh, there's a lot of things to keep track of that takes a lot of energy in my day that I'm not really used to. And then adjusting to these new things, right? So I think baby sleep is a big one that like makes sense for us to be a little more cautious about in a good way, right? Like we want to make sure baby's sleeping in a safe place and all of that. And I think it's another one that like hospitals or medical settings can really like ramp up our like overwhelm and worry about, right? With like all of the like safe sleep things that we need to do and all this stuff. Some of it is great. Some of it's like a little too much. I don't know. I have my own philosophies on all of the sleep rules and stuff. But yeah, we want to make sure that we have baby in a sleep environment where they're not going to like have a blanket, over their face, or they're not falling asleep on the couch, or we're not passed out on the couch with them or something like that, right? We want to be extra cautious because it's really important. And we're told about all of the things that could go wrong. So even if you don't have anxiety, you're probably worrying about that a little bit, right? Of like, am I doing the things right to like keep my baby safe, right? And it's healthy to feel a little more cautious because you're probably not used to that. If you haven't had a baby before, you're not used to doing those things. It's good to feel a little more like it's on your mind, right? Another area is, of course, baby feeding. So most new parents are like figuring out like, how are we feeding our baby, right? Are we breastfeeding? And if so, like, is that an easy adjustment for us? Is that tricky and challenging? Breastfeeding challenges can be common. That was something that I certainly went through that was really tricky. That caused definitely in the like anxiety realm. But like even if it doesn't bring up anxiety, it can be overwhelming. It can be a lot to figure out. Or are we going the formula route? And now we have to figure out like, okay, how are we measuring out these ounces and making sure we have enough milk prepared and cleaning out the bottles, or you might be doing a mix of things. So there's just a lot to figure out. Figuring out your routines, learning these new skills, all of that. You're going to feel a little overwhelmed. You're going to feel maybe a little on edge, a little bit stressed. That makes sense. And then we'll name in hormonal changes. And this can be for birthing parent as well as non-birthing parent, but of course, a bit more significant for the parent who gave birth, right? So their body just had this big 9-month transformation, so many physical changes, hormones going up and down, and now you have this baby and your hormones are going through some changes, right? It makes sense that initially, those first like a handful of weeks, the first month, like you're going to be feeling those hormonal changes, and it doesn't necessarily mean you're in the realm of postpartum depression or postpartum anxiety, but you might be feeling a bit more anxious or a little bit depressed, right? Like those baby blues. So you might be feeling either just a little bit more worried than you usually would or a little bit more sad than you usually would. It's not going to be super intense or take a big hit um, to just how you feel about yourself and how you're navigating your daily life tasks. But you might be like, oh, like, I don't feel like myself. I feel off. And this can happen postpartum, of course, when we have this big, swift change in hormones, but it can happen throughout the whole process, right? So for me, I just knew situationally wise, I was a bit more wired to like go through anxiety. That's something I've had before. So I knew this transition in life was about to bring some changes in it. But certainly, like early in pregnancy, I noticed this change in hormones made my anxiety show up in different ways than it usually would, at a different intensity than it usually would. So you might notice things that you've previously experienced, like it turned up a little bit. So it can be normal and healthy for those changes to occur, but those hormonal changes, I mean, of course, like, I think we look at the postpartum period as not just the first like 4 to 6 weeks or 3 months, even. It's the first couple years, maybe even 3 years, right? Where your body and your hormones are like getting back into their balance. And this is gonna like that timeline extends more if you are breastfeeding, right? So we know some people breastfeed past those first couple years, right? When you eventually wean, your hormones are going to change again. So throughout any of these changes, you're going to have some hormone shifts, which doesn't necessarily mean you have a mental health diagnosis, but it might mean you could use some extra support because it's hard to go through those hormone changes. But if you're feeling those changes and you're like, "Oh, this is a lot. Am I okay?" Maybe you can breathe like a little breath of fresh air of like, it's normal for me to not feel like myself right now. It's normal for this to turn up the volume on what I might be experiencing. But that doesn't mean you can't get support, even if it's just for a short period of time. So that's kind of what these like normal newborn or pregnancy or postpartum worries might look like. So we're going to feel a little bit more cautious. We're going to feel a little bit not like ourselves. We're going to feel a little bit more worried. That's all normal. But the difference is how intense is it and how much is it impacting my functioning. So with these very normal, maybe non-diagnosable worries or changes, it might just be like, oh, I notice I'm feeling a little bit off, but it's kind of just momentarily, right? Like I can get back into my routine, figuring out these new things that I'm doing. I might feel overwhelmed, but I'm not ruminating on it. I'm not feeling really stuck in it. Of course, right, with these hormone changes, you're probably gonna have moments where you're crying or like feeling more emotional than usual, but it might be like, oh, that was weird. Like, oh, I'm okay though. And after that moment, like I can kind of feel a little bit back to whatever I'm needing, right? So the intensity isn't super high. It's something you notice that you can observe, that maybe your partner observes too, but isn't like at a high extreme where you're like, whoo, like something's really off, right? It's just like, oh, I feel a bit different, right? I feel a bit off my usual experience, or my mind is functioning a little bit differently, right? That would make sense. It's not going to necessarily impact your functioning so much, right? So while the tasks might be a lot, and while it's like a lot more to hold and manage, and you might kind of feel like, oh my gosh, I can't find my footing because I'm doing all these new things and I'm going to baby appointments and my own appointments and all this stuff, like that's going to feel like a lot no matter what. But the reason that your functioning feels a little bit different or your stress level feels different is just from the tasks themselves or the things that you're doing, and not from how you're feeling, right? So it's not like, oh my gosh, I'm up all night so anxious and I can't sleep. That's going to be like, ooh, maybe some postpartum anxiety or perinatal anxiety, versus I'm having a hard time sleeping because I've got a newborn, or I'm pregnant and uncomfortable, or whatever, right? Like it is, what is the reason my functioning is changing, right? Is it because what's going on inside, or is it just because what I'm navigating on the outside? Which is going to be a hard thing to answer when it's in the realm of postpartum anxiety or perinatal anxiety, because you're going to be impacted by both, right? You're going to be impacted by the situation, but also what's going on inside. So now we'll talk a little bit about what that perinatal anxiety diagnosis can kind of look like, or what those symptoms might look like. And this affects like 15 to 30% of women or birthing parents. So I'm gonna like a lot of this research is with like male female relationships. So that's kind of how the data shows us. But like, yeah, it's gonna be 15 to 30% of the folks who gave birth are gonna experience this. And it says 10% of men, or I would say 10% of partners, right? Because your partner's not always gonna be a man. Now I don't know how that would be different with a female or non-male partner, but you know, it's going to be a lower frequency for the non-birthing parent, probably because they don't have as significant of those hormonal changes, but it's still pretty common, right? So we can look at this and be like, these numbers, they're high, right? And in fact, like the biggest complication during pregnancy and postpartum is mental health, right? And yet it's not talked about enough. It's not talked about as much as a lot of these other things that your doctor is like continually checking in on, right? Like every single doctor's appointment that I went to, they're like checking your blood pressure and making sure you're not at risk for preeclampsia, which is great. But that risk is lower than navigating postpartum anxiety, postpartum depression, those kinds of things. So it should be assessed more. It should be talked about more. It's not. That's why we're here talking about it. Yeah. So it's common, right? Like it's not going to affect everybody. It's not like over half of the people experience it, but it's fairly common. You probably know someone who has experienced it. Or if you're listening here and you know me, you know someone, right? Because I've experienced it myself during pregnancy and postpartum. Lots of anxiety. Fun times. But let's get into what some of these symptoms look like and how they might differ from just that maybe normal, like, oh, I'm a little more cautious or I'm a little overwhelmed or worried. This is going to be that higher intensity. So the worry here is going to be more excessive, right? It's going to be like, ooh, throughout the day, like I notice I'm worrying about a lot of things, right? And I might be worried about the normal things, right? Like maybe it's safe sleep or did we feed enough or what does that look like? But it's going to be something where it's like my mind is racing on it, or we might be worrying about things that are kind of like maybe not things that we actually need to be worried about or more cautious about, right? We might be worried about like, ooh, like, you know, we're going out for a walk. Like, what if this happens or what if that happens, right? So we might have some more anxiety or some of those intrusive thoughts that can come with OCD can show up kind of within the same realm. So we have a lot of worry thoughts and they might be pretty excessive and they might be pretty intense. They take our focus. So instead of it just being this like passing thought of like, oh, I should check if the last time I did a feed, I'm not sure how long ago that was. Gosh, I got to make sure I'm checking in on that. It might look like, oh my gosh, am I feeding my baby enough? Do they look too thin? Are they gaining weight the way that they need to, right? So we might be checking more things or feeling a bit more like frantic or intense with how we're worrying about it. And then these thoughts are happening frequently throughout the day. So they're kind of like on a running loop, right? It might not be every single moment of the day, but they're coming up and they're coming up at an intense amount and holding our focus. And here, some things that I see in my practice a lot is people who are tracking a little bit more intensely, and that tracking is maybe causing some stress, right? So I think it's normal, right? We've got all these baby apps where we're tracking stuff. And if it's like fun and okay, right? If you're like, oh, like this is how many hours baby slept last night, or this is kind of what their schedule is looking like, or how many ounces, and this is how it's changing throughout the day or whatever, like that's okay. If it's not stressing you out, don't worry about it, right? But if you are tracking things, you're getting anxious about things, and you're like having more worry thoughts based on the tracking, or gosh, I forgot to log that. Like I need to make sure I log it. If there's some like kind of obsessive qualities with it, that might be like, ooh, I'm in the anxiety realm, right? So that's where it looks like, right? At a higher intensity, right? The worries might have a root that's kind of the same, but the intensity, the frequency, the impact is higher. And then next, we have a difficult time controlling that worry or like holding space for it. So maybe your usual coping skills or self-care things that usually work on a day where you're feeling a little bit more stressed or on edge, but you're trying them now and you're like, they're not working. I'm still feeling worried. I'm still feeling overwhelmed. I can't shift my focus. Now I'll name that it's going to be hard for your previous coping skills and self-care strategies to work as well, because if you've got a baby, you don't have as much time to yourself, right? To do the things that you do, right? You're especially in the first like 3 to 6 months, you're like, it's a good day if I get a shower in, right? Like self-care is a hard thing to do. Coping skills are a hard thing to do. But right, you get the idea, right? The things that usually used to help me get my mind off of a worry aren't working the same way, right? I'm feeling stuck on these more than I used to, can kind of be a clue to, there's some anxiety present. Another piece is we might have some physical symptoms to our anxiety. So I think our body is a really great communicator. It likes to communicate to us what we're feeling. And anxiety has some common patterns of how it's going to show up in our body, right? So that might mean we feel a little bit jittery, like we're like, ooh, like I can't feel like I'm sitting still, or I'm feeling a little bit more restless. A lot of people will, of course, notice like, ooh, like I feel like I have butterflies in my stomach, or I feel like my stomach is like doing flips there. Like I'm just feeling really nervous in my gut, because we have all those neurotransmitters there that are going to speak loudly. We might feel like it's hard to catch our breath, or breathing really rapidly or from our chest. Our heart rate might be a little bit more rapid. We might feel like I'm hot, my palms are sweaty. Maybe we notice, I think a lot of people are like, ooh, like my sweat smells different, right? I got the stress sweat and I can smell it, and that's different, right? So those are some of our physical symptoms that are going to show up more often with anxiety. Maybe it's that physical tension in your face, in your shoulders, wherever it is. The more that you tune in and get curious, you're going to get an idea of what is my body communicating to me, what emotions there. So feeling those physical symptoms might let you know, oh, this might be anxiety here. Another common symptom of anxiety is irritability. So feeling like, ooh, I get frustrated, or like kind of like overstimulated or really overwhelmed easier. I feel a little bit less resilient to life stressors, or I'm getting really frustrated with my partner. I'm feeling frustrated with my baby or my support system or whatever, or with myself, right? I might be more angry with myself. So irritability can be something that shows up. And again, a little amount of this is normal, right? Because you've got so much more on your plate. Makes sense that you and your partner are not going to feel at 100% right now. Like you're not sleeping as much. Like all of these things are going to contribute to feeling a little bit more on edge, a little bit more frustrated. But if you're like, ooh, like I'm feeling that like mom rage, or I'm feeling a bit more like tense and frustrated, that might actually be a symptom of anxiety, right? Which I think is helpful, because sometimes we don't recognize that, and then we get angry quickly and we just feel guilty, or like we need to do a better job at communicating or regulating our anger or whatever. And it's like, if we miss that the root cause of it is anxiety, we're not going to get very far with it, right? So if it's anxiety, it's like, ooh, I'm going to need to work on that anxiety in order to shift how that irritability shows up. And then a last one is we might have a difficult time concentrating or focusing, which I know this is a hard one to maybe really identify, because you're going to have a little bit of that brain fog, especially if you're the birthing parent and you're having like significant hormonal changes. Your brain's functioning a little bit differently. We know like our brain changes after having a baby, and because it needs to, right? It's like focused more on the relational needs for you and your baby. Like it's a very like protective factor for human life. But it's a little bit harder to like focus or remember things or concentrate. So I know that that's a normal one. So this is like really hard to pull apart. And we've got so many more things on our plate. It's like, oh, like, is this the difficulty concentrating from anxiety, or is this just like the normal brain fog that I'm going to experience? Sometimes it's hard to identify, but coming back to, hey, is my difficulty concentrating maybe stemming from the fact that I am so worried, or so like overly focused or ruminating on certain things, and then it's really hard for me to be in the moment, right? So that might be your differentiation of it. So those are kind of the main symptoms here. There's certainly not like every single way that it can possibly show up, but some of the common ones. And again, this isn't just like going to be right after baby's born. It's not just the first like 3 to 6 months, which I know people commonly look at as like what it means to be postpartum, but this can happen earlier, right? So it can happen even before conception, right? If you are thinking about having a baby and trying to plan that and getting anxious, or going through infertility stuff, that that was part of my story, which certainly contributed to me feeling anxious before the process even started. So it can start then. It, of course, can start through pregnancy or going through hormonal changes. All of these same things can show up really in the same way. And then postpartum, which most people might start to notice symptoms within the first 3 to 6 months, but not everybody, right? This can last out for, a couple of years. We're in this like postpartum phase where our body is just getting used to this transition that we've had in life and getting back to our new normal. And you've got a baby, right? Or a toddler, right? You're going through some changes. And so for some people, it can feel really surprising if it's like 1 year later and you start to notice symptoms. That can feel really confusing. But know that that is a way that it can show up and does for some people. So it can be later. And really, regular non-postpartum anxiety, non-perinatal anxiety is going to look kind of similar. The answer is still the same. You can get support, right? So now we'll segue into what you can do about it, right? And I want to name that this is not just for if you meet the criteria for anxiety. It can be if you're just feeling a little overwhelmed or wanting to hold some different space for yourself during this life transition, you can get support. But yeah, if you're listening to this and you're like, I feel like I checked some of those boxes, that might be a nice time to be like, I'm going to meet with a therapist to like actually get assessed. Here, I'm not diagnosing anybody. I'm just talking about some common symptoms, but like go to a professional to learn your story, to see your symptoms and see if you fit the criteria for meeting anxiety. Work with a therapist, right? So I'll put it in the show notes, but you can go to Postpartum Support International. They have a great nationwide directory of therapists who specialize in perinatal mental health. So I'm on there, but it's people who have training and experience in supporting people during this time in life. Because if a therapist maybe treats anxiety but doesn't work with the perinatal population, they might not be the best fit for you. So be picky at what kind of therapist you're going to work with. Make sure they specialize in perinatal mental health because they're going to get it better, right? So working with a therapist who's going to understand your lived experiences, have some research to be able to support you a little bit better is going to be great. So you can find a directory on there. Or if you're in Minnesota, we have some openings at Minnesota Attachment Collective. I'll give my plug in there. So you can also head to my website to learn more about me and my work and what it's like to work with me in there too. But yeah, work with a therapist that you feel comfortable with, that you trust. Or if you already have a therapist that you have that good relationship with, you might circle back to them, say, hey, can we have some more sessions? Could that be helpful? Another thing that can be helpful would be medication. So certainly, I know it can be, especially if you already have anxiety, you might be like, ooh, I feel anxious about getting on medication, right? How's that going to affect me either during pregnancy or postpartum? Or if I'm breastfeeding, we might feel more nervous about it. And I can say that like there are tons of medications that are really safe. Your doctor's going to know. If your doctor doesn't know, make sure you get a doctor who like understands it. I'll also put a link in there of like how you can direct your doctor to get some information from someone who does know. They can consult. But most providers are aware of, okay, what's going to be okay and safe for pregnancy, postpartum, breastfeeding, all of that. I'll say that I got on medication postpartum, and my biggest regret is that I didn't get on it during pregnancy because I didn't really realize how anxious I was during pregnancy. And for me, I was on medication. I don't even know how long, a handful of months postpartum because my anxiety was higher, and it really shifted my experience, right? I was in therapy too, of course, but based on where my hormones were and just like that physical anxiety was, like I needed something to help my brain process that a little bit better. And so that really worked for me, and I wish I had started it earlier. So if you're thinking, would that be helpful for me? I encourage you to ask your OB, ask your doctor, usually your primary care or your OB if you're still in prenatal care. Can help you figure that out, get you started on something that's safe, that's totally safe, works well. So that might be a nice addition to therapy. And for a lot of folks, it's it's going to be short term, right? Like maybe it ends up being a long term thing that works really well for you. Awesome. Maybe like you've needed it before, and now this is like the start to be like, okay, now I've got it for a while. But for a lot of people, it might just be short term, right? Maybe for like a few months or a year or two, just like as your body is navigating all these changes and needing that extra support of medication. Totally fine. And then you work with your doctor to slowly phase off. Don't just jump off on your own, but work with your doctor to slowly phase off. You might not need it for the long term. A lot of people just have it for a short term period of time. So if you're feeling really anxious, of course, get some therapy, get some support, maybe add in medication with it too. There's also a lot of support groups, again, on Postpartum International. They have a lot of free groups, free support groups that you can attend to feel like you're not alone in it. So I'll put links to all of this stuff in the description. So if you're like, ooh, I could use support, again, whether you feel like you fit the criteria for anxiety or not, you deserve support. You're going through a big life transition. And the way I look at it and with my clients is like any life transition, but especially the transition of parenthood, brings up so many opportunities for us to learn about ourselves and grow into ourselves. And when we allow ourselves to get that support, to hold space for what we're feeling and what we're navigating, then we can be so much more intentional with it, right? We can connect to, okay, how do I want to show up for myself? And as an added benefit, now I get to model this for my kiddo and they get to see this. And it's going to support my parenting and it's going to support my relationship with my kiddo. Most importantly, it's going to support me, right? Because I deserve that. So I think it's great, whether you feel like you're having a really rough go at it or not, to get that support. You deserve that support. It's okay to get support. But overall, I hope this episode was helpful in identifying what perinatal anxiety can look like and how that maybe differs from just the very normal, healthy kind of areas of being a little more cautious that we might experience. And if you liked this episode, I just so greatly appreciate any rate or review or share, anything that you can do to support the growth of this podcast. It means a lot to me and I really appreciate it. So thank you if you are able to take a couple minutes to do that. Otherwise, I hope you have a lovely rest of your week and I will look forward to chatting again next week.